So 5 symptoms that might suggest that you have vitamin D deficiency. First one, fatigue. Second one, depression. Third one, pins and needles impacting your hands and feet. The fourth one is bony or joint pain. And the last one is muscle pain or weakness. So why is vitamin D required? So vitamin D is really needed for 3 systems in the body. It's needed for our bones, our musculoskeletal system. It's needed for our immune system, and it's also needed for our nervous system. So it is an essential vitamin. It's fat soluble. 1/3 of Australians seem to have a deficiency at any one time, and that's very constant. If we look at the USA as well, very similar numbers, about 35% of people at any one time have a deficiency, which can range from being quite mild, moderate, or severe. How you know that you have a vitamin deficiency, apart from potentially having the above symptoms, which of course overlap with so many other health conditions, is having a simple blood test, and you can arrange that through your GP or family doctor. There are some people who are higher risk of having a vitamin D deficiency, and so if we have a think about where vitamin D is made and how we get it, then that kind of will help us understand why someone might be vitamin D deficient. So most people know that vitamin D is mostly made from sunlight, but we also get it from certain foods as well. So if we think about people who are immobile, who spend a lot of their time indoors, so if we think about people who live in an aged care facility or people who've been hospitalized for a long period of time, they're very often vitamin D deficient. Another group who are vitamin D deficient for the same reasons are people who, for religious reasons, cover up a lot of their skin, and also dark-skinned individuals seem to have a greater propensity to having vitamin D deficiency. And then if we think about it from the gut perspective, so we know that some vitamin D is absorbed through specific foods in the gut. So people with gut conditions such as celiac disease, which is severe gluten allergy, they often are at high risk of vitamin D deficiency. And people who have inflammatory conditions of the gut, such as Crohn's disease, can also have vitamin D deficiency. There are certain medications that seem to put you at higher risk of vitamin D deficiency, and they include steroids. So there are definitely quite a lot of people who take steroids for various conditions, including things like asthma, chronic lung diseases, autoimmune diseases. So again, they're a group who are at high risk. The other medication that can help or can impact, vitamin D is anti-epileptics. If you think about how we're going to improve people who have vitamin D deficiency, obviously we can use supplements, and that's something that you can buy over the counter at the pharmacy. However, I would say that it's probably better to know whether you have a deficiency or not, because you can get toxicity, and you can have too much of certain vitamins, and vitamin D is one of those, and it can actually lead to quite bad consequences in terms of ending up with a high calcium level, and then ending up with potentially kidney damage as a final stage to toxicity. So we're definitely not something that we want to take if we don't need it. If you're someone who is proven to have a vitamin D deficiency, as I said, you can buy yourself a supplement. In Australia, that's something that's been able to be bought over the counter. But it's also important to think about how you can get those natural sources. So sunlight is the big one. In Australia, we're always navigating that really tightrope because, of course, the rate of skin cancer in Australia is the highest in the world, and we're always trying to avoid too much damage. So it's thinking about maybe having some sunlight in the early morning sun when we know the UV index isn't as high, it's usually not as hot, and the sun isn't as high in the sky. And we usually say that if you can have bare arms and bare hands and a bare face for 10 to 15 minutes in the morning, then you should be able to make some vitamin D. The other foods that have vitamin D are some of the more old-fashioned foods like cod liver oil. Fatty fish also has vitamin D in it. And then we also have foods that are fortified. So lots of drinks and breakfast cereals and things often have some fortification with vitamin D. My least favourite food, mushrooms, also has vitamin D in it, but I won't be eating those. That's just a personal preference. So in conclusion, vitamin D is really important for your bones, stopping you getting osteoporosis, which we know is a really big issue in Australia and across the world. It puts you at high risk of having fractures. The older you get, the more serious the consequences of those fractures are. We also know, as I said right at the beginning, it can impact your mood, it can impact your muscles, and it also can impact your immune system. So for that reason, I think it's really important that you know if you're vitamin D deficient. So if you have any concerns, next time you're at the GP, ask, can they check your vitamin D when they're checking your bloods? And as long as you're sufficient, you don't really need to do anything. If you've got a deficiency, then you've got to think about using a short-term supplement, but also being mindful about the natural ways that you can maintain your vitamin D level. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.